Hi everyone, welcome back to my channel MLT Super Guide. Today I am going to discuss the most important topic in biochemistry, that is quality control. So first of all, the definition of quality control. Quality control in a medical laboratory is a continuous process of monitoring, evaluating and improving the analytical process to ensure the production of reliable and accurate patient results, ultimately it contributing to a better patient care and outcomes. So the concept of quality control is to provide a reliable and accurate patient result, and it is now well established in all the laboratories. It now a routine requirement to include quality control samples in each turn of the test. Laboratory staff must be conscious of how the quality of their work affect the diagnosis. And for quality control, we have a quality management system to control all the procedures. So under the management system, we have a proper quality planning and the quality lab processing, which means what all the systems techniques we are used in our laboratory should be attain a quality. Next is what is quality control and quality assurance, and finally how to improve the quality. Next, little bit about the quality planning. Why we are using the quality planning? It's very clear. It's used to eliminate the problems and monitor the problems and take necessary steps to standardize the remedy or issues. And as we all know, there will be so many area that errors can occur during the laboratory procedures. It may be pre-analytical, analytical, or post-analytical. So we have to find out in which area the errors has occurs or how many type of errors are there. So we have to point out which error and then utilize or use the correct remedy to rectify that particular errors. Next is quality of lab processing. How we will attain the quality during the lab processing. It's simple. Every lab must keep a SOP. SOP means standard operating procedure. So all the laboratories should display SOPs for blood collection to report. So all the staffs can follow the same procedure and we can avoid the errors. And next important point is always use the gold standard methods to get a more precise and accurate results and avoid the old methods. And quality control, the importance of quality control, prevent the consequences, detect the problems early enough to prevent it. And next is the quality assurance. And quality improvement means training. So the proper, regular, timely training is required for the lab staff. And identify the root cause of a problem, establish the solutions for it. It's simply quality control. It's a very simple definition for quality control. That is, it is a set of process for detecting errors. Errors can occur even in the best laboratories also. So, any time error can occur. And good quality control will provide the clinician with a high degree of confidence in the clinical data generated by the lab. As a result, the patient will get the appropriate treatment. So quality control is a process of detecting errors. Next term is the quality assurance. Quality assurance means it's a system or a set of procedures in place to prevent errors occurring. So already we discussed quality control means it is a procedure to detect errors. Quality assurance means system or procedures in place to prevent the errors. So should not be confused with the quality control, because quality control and quality assurance both are complementary systems. A good lab will have both these systems working together to ensure the reliability of the test result to give the best patient care. Next is a little bit about the error classification. I have already told there will be different type of errors are there, and it is classified pre-analytical, analytical and post-analytical. So pre-analytical means errors before the sample reaches the laboratory. That's why pre-analytical, before the sample reaches the laboratory or the analytical area. And analytical. Analytical errors means from the name itself, errors occurs during the time of sample processing. And finally, post-analytical errors. These are the errors occurs after the analysis, that is during the time of reporting or data analysis in calculations, transcriptions. So the errors comes during these procedures are comes under post analytical errors. This is a diagram. Here we can see pre-analytical area, that is from the patient care to patient transport up to the analytical area. And analytical area, it is the area where we are doing the quality control of the samples and the test procedures. Next is the post-analytical. We are reporting, record keeping, transcriptions. All these procedures are comes under the post-analytical. So in each and every step is very important. Any error occurs in any of this area, that will definitely reflect our result. And pre-analytical errors are the most common type of errors, approximately 70%. And secondly, analytical errors, 12%. And finally, post-analytical errors, that is approximately 18%. So we have to give more concentration equally in all area, but particularly for pre-analytical area, because 70% errors are occurring in pre-analytical area. Next, moving on to pre-analytical errors. Although they occur before the sample reaches the lab, they directly affect the quality and usefulness of the result. There are many type of pre-analytical errors. Then we can discuss each by each. First one is the improper preparation of the patient. So patient preparation is very important, and we all know for the glucose estimation, fasting is necessary. So the correct period of fasting is very, very important for the accurate result. And other factor is stress and anxiety. So definitely stress and anxiety, that will affect the urine protein levels. Next is during the time of the collection. During collection, the most important error happening is the sample hemolysis. So what will happen if sample hemolysis occurs? As we all know, sample hemolysis causes the breakdown of the RBC cells, red blood cells, and it can significantly impact several biochemical parameters to increase, especially due to elevated levels of intracellular components like potassium, enzyme lactate dehydrogenase, aspartate aminotransferase. Other affected parameters are included bilirubin, creatine, creatine kinase, and hemolysin can lead to incorrect diagnosis and treatment decision. So it is very important while sample collecting. And next important criteria, if hemolysis is occurs, what is the next step? Definitely reject the sample and recollect the sample. So it is important to collect a new sample to ensure accurate result. Next important point is the insufficient sample volume. So if we have to do LFT, RFT, TFT, so many tests we have to do for a particular patient. So if we get a sufficient volume of sample, then only we can complete all the tests. So if there is insufficient sample volume, we have to reject and again requested for a new sample, or we have to repeat the blood collection. Next is about the collection timing. Collecting and accurately time the volume of urine. It is very extremely important when looking at an analyte levels in a 24-hour urine sample. Next is about the order of adding blood. So once we collected the blood, and we have to add into different tubes. So first one or first preference is the blood culture. Why blood culture? This is because to avoid the contamination. Next is PTINR. For PTINR, we are using the sodium citrate anticoagulated tubes. Next is clotted tube serum sample. Next is EDTA, then heparin and fluoride. So this order of adding blood is very important to avoid the contaminations. So blood culture first, then PTINR, then serum, EDTA, heparin, fluoride. And third part of the pre-analytical error is the incorrect specimen container. So it is also very important. We have to, a laboratory personnel should know in which container is used to collect the blood sample for the particular test. So mostly for the hematological parameters like completed blood cell count, ESR, we are selecting EDTA tubes, and if there is a glucose estimation, using the fluoride oxalated tubes. So the anticoagulant, the selection of anticoagulant is very important. It's serum or plasma. If we have to get serum, serum is obtained from the clotted whole blood and plasma from unclotted blood. Sample collection for plasma must be done into a tube containing anticoagulants such as EDTA or heparin and fluoride tubes for glucose. This is why fluoride is used for glucose in order to inhibit the glycolysis. So the ratio of sodium fluoride to potassium oxalate. This is the anticoagulant used for the glucose estimation. So sodium fluoride and potassium oxalate is used in the ratio of 1 is to 3. It is used to prevent the coagulation and it inhibits the sugar decomposition, allowing accurate glucose measurement. Next is EDTA. EDTA is unsuitable anticoagulant for calcium because EDTA is a calcium chelating anticoagulant. It will bind with the calcium. As a result, incorrect values of calcium will obtained. Next is incorrect specimen storage. Sample left overnight at a room temperature will definitely cause elevated levels of potassium, phosphate, and red blood cell enzymes like aspartate aminotransferase and lactate dehydrogenase. This is mainly occurs due to the leakage of intracellular fluid into the plasma. As a result, the concentration will increases. Next is delay in sample delivery. Unstable analytes require fast handling and analysis. So maximum avoid any delay in sample delivery. So these are the main pre-analytical areas. First is improper preparation of the patient. Second is improper collection of the blood sample. Third one is incorrect specimen container, then incorrect specimen storage. Some other factors are also affecting, that is the sex of the patient, whether the patient is male or female, age of the patient, dietary effects, whether low carbohydrate diet or fat diet or high protein or high fat diet. So all these dietary effects will definitely affect our final result. Again, when the sample was taken early in morning for the urine collection, that is mainly used for the pregnancy testing. Next is the patient posture. Urinary protein in bedridden patients, there will be variation, and other factors such as effect of exercise, especially in the level of creatine kinase. And if the patient will have a medical history like heart disease, diabetes, existing medication, in pregnancy time, there will be hormonal effects, then effect of drugs and alcohols that will mainly affect in the liver enzymes. How do these factors come under the banner of quality assurance? The quality of the final result will be seriously affected by these outside factors. So the lab must minimize these risks by establishing effective standard operating procedures and also provide training for people using the laboratory service. Next is about the analytical errors. So under analytical errors, the most important factor is the sample. Incorrect labeling while barcoding or allocating, then incorrect preparation, centrifugation or aspiration. We have to aspirate the correct volume of the sample. Again, centrifugation, speed and time should be correctly follow. Then incorrect storage. If there is a short term, then we can use refrigeration. And medium term storage, freezing at minus 20 degrees Celsius. For long term freezing at minus 80 degrees Celsius. And correct test selection is the another important point to avoid the analytical errors. Next is glassware, pipettes and balance. So always use correct glassware, pipettes and balance for the test. If you are used incorrectly, the result will vary, and do not use contaminated glasswares or pipettes. And it is very important to calibrate the pipette at regular intervals, and you avoid reuse of pipette tips because the reuse of pipette tips will definitely cause the contamination of the target elements or the target biochemical parameter which we are going to analyze. So avoid reuse of pipette tips. Next is reagents, calibrators and controls. So always use good quality reagents. Avoid poor quality. Then inappropriate storage, incorrect temperature, Poorly maintained fridges or freezers. For maintaining the correct fridge temperature, we have to use thermometers to record the fridge temperature. For that, it is very important to keep a temperature chart for fridge and record everyday temperature. Next is about the stability of the reagents. So the reagent should be in a good quality reagent. It should not be outside the shelf life, and incorrect preparation. Incorrect preparation is mainly comes for the lyophilized samples. We have to reconstitute the lyophilized samples correctly. Next is the application of the application. That means incorrect analytical procedures or poorly optimized instrument settings. The above will lead to errant results with even the best quality reagents. If we are using good quality reagent also, if there is any issues occurs during the optimization in the instruments or incorrect analytical procedures, we never get a good quality result. So the quality of reagent is very important. Next part is instrument. To avoid the analytical errors, it is very important to avoid the errors from the instrumental side. So we know all the instruments will have an operational limitations, mainly the temperature control, read times, mixing, carryover. So all these steps we have to do very carefully. The lack of maintenance, worn tubings, optics, cuvettes, everything will be used properly. Other factors are calculating errors, incorrect factor or wrong calibration values, transcription errors, and dilution errors. And dilutions may be done when a sample value exceeds the assay linearity. We know each and every test will have a linearity. If the test result exceeds the linearity, we have to do the dilution, and the result value should be multiplied with the dilution factor. Next factor is the lack of training. Already we discussed the timely and proper training of the lab staff is necessary. Next category is post-analytical errors. The prompt and correct delivery of the correct report on the correct patient to the correct doctor. Then only the clinician interprets the data to the full benefit of the patient. So this is about the post-analytical error. That's we have to correctly give the report to the patients. No error should not be occurs while the transcription or reporting time. Next, a little bit about the systematic errors. Systematic error is evidenced by a change in the mean of the control values. The change in the mean may be gradual or demonstrated as a trend in control values. The reasons mainly for systemic errors are improper calibration, unstable reagents, change in reagent formulation, gradual deterioration of control materials, and unstable sample blanks. Next is random error. Random error is any deviation away from an expected result. For QC result, any positive or negative deviation away from the calculated mean is defined as random error, and random error is usually indicates imprecision. And reasons for random errors, mainly the improper sample, pipetting errors, improper mixing, lack of stability of water bath, and timing regulation problems. So these are the main 5 important points that causes the random errors. As we cannot detect type of errors by reading values, only we need statistical analysis of QC values. For that we need QC charts and calculations. Already we discussed about shift and trend in systemic and random errors. So what is mean by shift? Shift means control on one side of the mean on 6 consecutive days. That means 6 consecutive days will get the one side of the control value. That indicate calibration error. Trend means control moving in one direction heading out of the control value. And causes of shift, failure of light source, change in reagent load, instrument maintenance, sudden change in incubation and temperature, change in room temperature and humidity, failure of reagent dispensing system, and inaccurate calibration. And causes of trend, deterioration of light source, aging of reagents, and loss of stability of control materials. Next, little bit about definitions of certain important terms used in quality control. There are several common terms used when analyzing laboratory performance, that is accuracy, precision, specificity, sensitivity, and linearity. First of all, accuracy. Accuracy means how correct our result is. That is the agreement between our value and true value. Determined absolutely by direct comparison to a reference value. So accuracy means the agreement between the your value and true value. More commonly assessed by using an assayed control serum with accurate value assigned by the manufacturer, and we will compare our value and the manufacturer's value. Next is about the precision. Precision means the reproducibility of the result. The reproducibility of result means the agreement between the replicate measurements. So how many times we are repeating the same test, we are expecting a closely related values. The closer your result are to each other for the same analyte in the same serum, the better your precision. There are two ways in which precision is assayed. One is inter-assays and the intra-assays. Just look through different type of examples. First one is accurate and precise. This is the most ideal situation. That means the test is accurate. The results are close to one another and mean is close to true value. So lab can have the confidence in single test results. So this is the ideal situation. Next is our method is imprecise but accurate. That means results are widely spread giving poor precision. Our values are low to the true value. The mean is close to the true value giving apparently good accuracy. So it is an unacceptable situation. Why? Here precision is lost but accuracy is there. Imprecise but accurate. It is an unacceptable situation. So labs cannot waste resources on repeating runs to get an acceptable level of accuracy. And other situation is the test result is precise but inaccurate. It means results are close together, giving good precision. But mean is not close to the true value, giving poor accuracy. So this is precise but inaccurate. Next is how we can solve precision and accuracy related problems. Poor accuracy relatively easy to solve, often calibration problem. So accuracy related problems we can solve by properly calibrated instruments. Then poor precision. It is a little bit difficult to solve because a variety of causes can cause imprecision. Poor quality reagents, badly maintained instruments or inadequate training. Next term is specificity. Specificity means the ability of a method to measure solely the component of interest. Lack of specificity will affect accuracy. The test is measuring component other than the analyte of interest. Consequences of a lack of specificity. As a result, falsely elevated values may occur. This is mainly happen when the structurally similar hormones are together, like FSH, LSH, TSH, and HCG all have an identical alpha subunit. All these hormones will have two subunits, alpha subunit and beta subunits, but they have a common alpha subunit and beta subunit will be different for each hormone. Here, as a result, what will happen when we are doing the assay? That method will specifically detect all these and hormones together because of the similar alpha subunit. As a result, falsely elevated value will occur. Next is sensitivity. Sensitivity means the ability to detect small quantities of a measured component. It will affect both precision and accuracy at the bottom end of the clinical range. Sensitivity means the ability to detect small quantities of a measured component. But specificity means the ability of a method to measure solely the component of interest. And false negative result always lead to decrease in sensitivity. False positive result always lead to decrease in specificity. Next term is linearity. Maximum concentration of analyte up to which the reaction is linear. If the reaction range is above the linear, we have to dilute the sample and again do the test, and the final result will be multiplied by the dilution factor. So the linearity means maximum concentration of the analyte up to which the reaction is linear. Next is the main important part. We should know what is the normal distribution, standard deviation, and coefficient of variation in quality control. First of all, the normal contribution curve. It is also known as Gaussian curve, normal contribution curve or the Gaussian curve. It describes events or data that occur symmetrically about the mean. If we consider we have 100 events, then out of 100, 68.7 will fall within 1 SD and 95.4 will fall within 2 SD and 99.7 will fall within 3 SD. This is the normal distribution curve, that is Gaussian curve. Sometimes MCQ questions will comes. What is the other name of normal distribution curve? That is a Gaussian curve. A precision means how dispersed the values are. How is precision quantified statistically? By measuring the standard deviation of the set of result. So from the standard deviation, we can quantify the precision. Next is standard. So all the time we are hearing in quality control standard control reference. So what is standard? A substance used for standardization is known as standard. Control means a sample with a known value, and this known value provided by the manufacturer. Next is how we will calculate standard deviation or SD. So this is the formula how to calculate SD. SD is defined as the square root of the sum of the squares of the single value deviation from the mean divided by the number of the values minus 1. SD is defined as the square root of the sum of the squares of the single value deviation from the mean. It is divided by the total number of values minus 1. What does standard deviation tell us? We will get some information from the standard deviation value. The average deviation for the set of result. And if the lower the SD, better the precision. SD means always we are talking SD plus or minus 1 SD plus or minus 2 SD plus or minus 3 SD. So lower the value of SD, better the precision. Next is quality control chart. And most commonly used quality control chart is Levy-Jennings control chart. So I just like to demonstrate how we will plot a Levy-Jennings chart. Ideally should have control values clustered about the mean with a little variation in the upward or downward direction, like ECG pattern. Some values are upwards and again downward, then upwards, downwards. So an ideal Levy-Jennings chart should be like that. That is, it should have control values clustered about the mean with little variation in the upward or downward direction. Imprecision. Large amount of scatter about the mean, usually caused by errors in the technique. So after plotting the LJ chart, if there is a large amount of scatter or the values are scattered about the mean, that indicate imprecision. It is actually a visual presentation of daily quality control value plotted on a chart using mean, SD and plus or minus 3 standard deviation range criteria. This is a typical example for Levy-Jennings control chart. For drawing a Levy-Jennings chart, we should have mean SD of QC material. That we will get it from the manufacturer. And in the x-axis, we have to plot the time of run, and y-axis the control values. So in this chart, we can see nearest to 100, there will be 90 in between 95 and 100, approximately in the area of 98, there will be a mean plot. And each and every days, we have 1, 2, 3, 4, 5 up to 24. And here the unlight concentration 80, 85, 90, 95, 100, 105, 110 and 115. So our mean is up nearly 98. So first day we done the glucose estimation. So we got the value 99. So there will be a plot. And second day again we run the control material. We got a value between 105 and 100. So plot it between nearly 102. Like that, everyday sample is plotted on the graph. Now the sample, the quality control material. So now we got a graph like this, and most auto analyzers plot the charts. Otherwise, they should be drawn manually. So here we have a 5 set of readings: 110, 113, 108, 111 and 109. So first of all, to apply the SD formula, we need to find out the mean of this value. So we have to add these 5 values, divide it by 5. So we will get a mean of 110. Next step already we discussed, we have to subtract each value from the mean value. So 110 minus first value 110. So after subtraction we got 0. Then 110 mean value, and our second value is 113. So we got a minus 3 value. Similarly, 110 minus 108 is 2, and 111 we got 1. 110 minus 109 we got 1. And next step is we have to